All right, well, welcome everyone to today's webinar. We've entitled it Proactive Triage Strategies to Win in 2024. It's sponsored by CareXM. I'm hospice news reporter Holly Vossel, and I'll be moderating this presentation. Before I go ahead and introduce our speakers, I just want to review a quick few items here. First, we would like to just let you know that our audience has been placed in listening mode only. We'll reserve time at the end for any questions that we have, and we really encourage you to submit those. Any questions or concerns that you do have, just use that Q&A function on your screens, and we'll address as many as we can. And secondly, just please note that this webinar is being recorded, and a link to the recording of this webinar will be sent in a follow-up email after today's discussion. All right, so without further ado, I just want to be able to please and to introduce our speakers today. We have our CareXM team, Ellen Kubrick, the Chief Growth Officer, Cindy Von Bank, the U.S. Director of Telehealth, and Deborah Goldbrand, she's the Director of Telehealth Clinical Solutions at CareXM. So welcome and thanks so much to each of you for being with us today.
Thanks for having us.
Yeah. All right, well, let's dive right into everything. The really topic that we're hitting home with today is, that last month, the U.S. Centers for Medicare and Medicaid Services, CMS, revealed that the 2024 Final Hospice Payment Rule, which definitely kept us busy in reporting, and I'm sure you as well. So that finalized home health rule also included some really important updates in the hospice space as well. And that's what we're really going to be digging into, what those changes really mean, what they entail. So then the challenges that they can present in the hospice world, and then strategies that some hospices can implement to overcome these challenges. So our first question, Ellen, you're the winner. You're going to be fielding this one. Let's just kind of dig into it at the high level of any insights into those key challenges that might be posed by that 2024 home health rule. And then we'll kind of dig in from there as far as how hospices can, adapt their own strategies around those challenges.
Yeah, that sounds good. So the 2024 Final Hospice Payment Rule introduces, I'd say, both good and bad aspects for hospice care providers. So while the finalized 3.1% increase in base rates is acknowledged and appreciated, providers are still likely to face some difficulties, particularly when we look at the broader economic context. The 3.1% increase is pretty easily outpaced by the reported inflation rate, which is at least over 4% in the last 12 months. So that means that we're operating at a net revenue loss of about 1% just right off the bat. That's compounded by escalating costs that are associated with labor and our continued scarcity of a skilled workforce. And it becomes even more pronounced when we look at increased expenses that are related to recruitment and retention, price and wage inflation. We have to kind of grapple with this reality of a financial strain that we're going to go into in 2024. It essentially translates to, at the very best, a net zero gain for hospice organizations. So that poses a threat to our financial viability and our ability to operate and give quality care. On top of that, the final rule finalized the application of a 4% decrease for hospices that don't comply with the hospital quality reporting program requirements. And they include the timely transmission of your HIS within 30 days, and also active participation in CAHPS requirements. And Holly, when we were prepping for this call, you and I talked about this is one area that can kind of cause alarm for providers, because it's not that we don't have quality top of mind, but this is more administrative work. We're collecting, submitting, we're managing timelines, and 4%, that financial penalty is really staggering. It's a big cut. Yeah. The last point I think about the final rule that I'll bring up is that the extension of the telehealth for face-to-face encounters is pretty notable. It's the extension from COVID is valid throughout the year. It does underscore the importance of using a HIPAA compliant platform. So when you're looking at telehealth, make sure that you're asking that question to vendors. But you should capitalize on this. We're getting kind of a win on this, that we're getting this extension of COVID telehealth flexibilities, and it should be an opportunity to really embrace health equity, extend services to patients that might not otherwise receive them.
Mhm.
But this extension comes with a caution to telehealth visits should still be case by case, evaluated that way to make sure that they're complementing rather than fully replacing face-to-face visits, and that they're preserving the quality of care. So if I would just say aspect of the final rule to keep in mind is that if you are using telehealth or telemonitoring, it's really imperative that you're meticulously documenting your costs on your financial reports in the world where one day home health and hospice do get reimbursed for telehealth. Those reports are really crucial references for determining reimbursement rates. So make sure that you are taking the time to document not just the costs that are associated with the equipment and the platforms, but also your staff costs in managing and training on equipment and conducting those telehealth visits. Again, this is another ask, right? It's more administrative work, but this is sort of an investment in our future. The strategic documentation now is going to ensure that you're well positioned to navigate that CMS reimbursement conversation later, and that we will maximize, what we get there.
Yeah. I think just one more piece of that, if I could add on to your point, Ellen, I think that each of those I can see those ties of financial impacts in each of those bits that you touched on here, from the quality reporting requirement in that home health rule, and then also something that, kind of percolated amongst hospice providers is that special focus program that's in that role also. And I think that was just one thing I would like to add on to that, as that those quality and financial impacts of that too. Because if hospices get lumped or flagged by that, there's some of that extra administrative response like that you were talking about, and just having those resources. So
Yeah, and we
okay.
saw that when they implemented that program with skilled nursing, is not only is it the extra lift, but then there's another financial threat to how many referrals are you going to get if
Mhm.
you're a special focus, and how do we navigate that and get out of it as quickly as possible. So just another thing to add to our list is that you've got to have knowledge of what's happening in all these programs, and how do I avoid getting into a situation that's going to have some financial repercussions.
Yeah. And I just kind of want to open this conversation up to also to Cindy and Deborah, if you had any thoughts to add on too, jump right in. But I think we can kind of shift to the second part of that question, as far as, how hospice providers should really adapt their strategies around all these sort of shifting things.
Yeah, I think it's very, very carefully. And it is this striking a balance, because you're in a world where you're constantly being asked to do more with less, and finding that sweet spot between keeping up with regulations, dealing with a perpetual staffing shortage, running your operation efficiently. It's just not easy. And we're all familiar with tightening our financial belts. It feels like we're doing it every year. Let's be real. Keeping our heads above water here is a pretty ongoing struggle. So we can't compromise on giving top-notch care. That's non-negotiable. But if we're expected to maintain the same level of care while cutting costs, while dealing with the administrative burden of these new regulations and programs, we've got to get creative. So the question really becomes, where's the wiggle room for us? And let's talk about this idea of doing more with less. It's not my favorite phrase, just because it's so overused that we hear it all the time. You've got to do more with less. It's a challenge. It means that we've got to find efficiencies that maybe we didn't think were possible before, or definitely didn't exist before. It's essential at this point that we're creating bandwidth for our caregiving team and allowing them to channel their expertise where it matters the most. And so what we want to talk today about is, where does technology come into play? And could we implement tech solutions that complement the human touch? And could that lead to a more effective allocation of resources and a more sustainable model of care delivery for us going forward? So can we free up some of our staff's time by letting technology, automation, these days you hear it all the time, maybe a little bit of AI even, handle certain tasks? That's kind of the game changer. And it's important to remember, we're not talking about replacing the human touch, because we should never do that. And we never would do that. We're talking about making room for the human touch by intelligently, and I'd say selectively, deciding where you could use technology to augment care.
And I think that that's definitely a difficult line to walk and afford for some as far as implementing those strategies, because it takes that time to sort of lay that groundwork, I think, of that technology, platform and that utilization. And like you're mentioning that the making sure it's all compliant as well with the HIPAA compliance and the things that you're using. So that's really a big question there, is how the hospices can strike that balance.
Yeah, and it's scary to know, where do I risk saying, yeah, technology can take over this function, and where
Mhm.
should it not? And so, one,
Right.
I think I'm going to let Cindy and Deborah kind of go into some strategies around this, but at least if you're starting to look at having technology augment care, one of the safest places to start to look to create efficiencies is that administrative world. So where is there an effort that is taking a nurse, a caregiver, time that it doesn't need to be a nurse? And one of the best ways for you to figure this out is to go ask your team. It's probably the part of their job that they like the least, and it's one
Mhm.
that they feel like they have to do to get to what they want to do, which is to give care.
Right. Or how do you avoid those redundancies, or
Exactly.
for the rooms for those operational efficiencies you were mentioning? Yeah. Okay. All right. Well, yeah, I think that kind of plays into the next question, as far as, some of the aspects of hospice care that can be effectively, supplemented or augmented or automated by the technology. And then what benefits providers can expect if they start kind of implementing these things. So that one, I think we have for Cindy to take. And what are your thoughts on that, as far as some of those aspects?
Thank you. Well, as Ellen alluded to, there are some really simple but very, very useful technologies that we can be proactive and create a better communication flow with that family member, the caregiver, the patient care team, and along with your care team. So sending out messages automatically about nurses. When is the nurse coming to the home, right? And I think many of us on this call have experienced, at least with us in the last year, of family members that have been on hospice, and we're working and busy, and then you get a call, but you can't take it because we're in a meeting, and then you're playing phone tag. So the technologies today, it allows your team, instead of the nurses reaching out, making phone calls, leaving messages, we can automate some of those messages without taking away that personal care touch. Virtual visits or telehealth. This isn't to replace that nurse going in and having that hands-on feel, but what it's meant to do is augment those nursing visits. So if a caregiver, family member is very anxious, it's really easy to click a virtual care button, connects you right to that family member or caregiver, and then that way you can have that higher touch, personal touch with that person on the other end, versus maybe trying to find a nurse that can go out to the home at that exact moment. So virtual care has really come into play during the pandemic. It was, virtual visits, telehealth, that's not going to work for patients or home visits, but it really did. The pandemic forced all of us, providers, care teams, patients, to really utilize the technology and find out that this is really easy to use and it is helpful, right? The last place you want a patient to go is back into the ED or hospital. You want to keep them safer in their home. So virtual visits is a good augmentation to help your team and those patients and those caregivers and family members be more connected.
And Deborah, I was hoping you could share a
Mhm.
little of your story and where a virtual visit would have come in handy too.
Absolutely. This has really been clarified for me this past year and thrown me back into the nursing world and patient care. My husband was a hospice patient and did ultimately pass away from cancer this past year. And just the whole experience of being back in the hospital, back at home, being at the bedside with him, it was so eye-opening to me that with the advances that we have in medicine, the coordination of care is, I would have to say, worse than I've ever seen it, because the nursing shortages have stretched the clinicians so tightly. But the people that are at home with these patients, they're really out there on their own. And I think to myself, if I hadn't been a nurse, or what are these people doing that aren't clinically trained? So you've got things that are going on constantly. Perhaps you need to have a medication change. Perhaps you're out of supplies, or you have something that's added in, like all of a sudden your loved one needs oxygen. Who facilitates that? And honestly, what it ended up being is me. I had to facilitate it. And so it was like I was a full-time nurse for this patient that I had at home, who happened to be my husband. And I just thought to myself, how could we make this better with telehealth? I've been designing these programs for 17 years. And I thought, if I had at least had somebody that I could have called other than the clinician, who, by the way, could never get back with me at a time that was actually convenient for me. And let's face it, if I am that nurse and I'm with another family member, not my own, if I'm with someone else, I want to be able to give them the time that they deserve. But what does that mean for me? If I had had somebody that I could call and have a virtual visit with, and me with all of the knowledge that I have, say, look, these are the medications that I have. This isn't working so well. Can you facilitate this for me and call the doctor? Otherwise, it was me doing those things. This would have been such an amazing tool to have. Even those messages coming out to me saying, are you out of any of your medications? Are you out of any of your supplies? So not just a virtual visit, but having the ability to communicate on a HIPAA compliant method would have been amazing for me, because it takes time to make a phone call. If I had had something like this, which is something that Ellen's going to show, this could have happened for me in seconds.
Yeah, Deborah, I really appreciate you, sharing your story, and I'm so sorry to hear about the loss of your husband, but grateful that you had that sort of support. And I've heard that from, providers as well, who are having those caregiver issues of like just educating them on what services are available to them. And even having like an appointment reminder for a caregiver could be a huge step when they have so much else going on, and so they're managing those pain and symptoms and being a part of that. So I can see, what Cindy was mentioning as far as those staffing pieces, and Ellen's point about, alleviating some of the operational efficiencies. And I think these all really tie together with that was sort of take home point on like what it means for that patient and family experience at the end of life. So yeah, lots of key
Talk
pieces.
to our clients about these tuck-in and check-in calls, and nurses are at the end of their very long, busy, emotionally taxing shift, having to call to do these tuck-ins, and it can often take up to 2 hours. And we've even heard that because of the limits on their time, they're only tucking in a portion of their patients, the ones that are the most critical. And this is another example of where technology does create those efficiencies, because for you to click off the 10 patients you want to send a tuck-in call message to, and they all get one, and you don't have to spend that 2 hours, and more of your patients got the tuck-in message, that's going to create stale, and that's more touch points with more of your patients, where we could catch things, and we could catch problems before they become something where it's so stressful to someone like Deborah that's a caretaker at home.
Yeah,
And I think just to tie in, just to tie in though, again, those patient or family giver interactions, they feel more connected to you without actually having to talk on a phone to you, right? If they know that you're reaching out towards the end of the day about medications, things that you want to talk with them about, they have those instantaneous communications with your team. So really important to use simple technologies that don't take time away from your nurses, but allow the user experience to utilize these touchscreen survey on the go, or the next slide we have coming up is a phone call. We can automate and set these appointment reminders.
Hi, this is Sarah with your hospice care team. I was calling to remind you that you have an appointment scheduled with your nurse tomorrow between the hours of 8 a.m. and noon. Are you out of any medications or supplies? Press 1 for yes or 2 for no. Thanks for letting us know. We're looking forward to seeing you tomorrow. Have a great day.
So the flexibility of technologies to communicate on the other end with however that person wants to be communicated with. Maybe it's text, maybe it's a quick survey on the go, maybe it's a phone call, a voice reminder, appointment reminder. And I know Deborah experienced this as well. The nurse was supposed to be coming out in the morning, and then there was a no-show, there wasn't a phone call or a message, and she's trying to wait and schedule her day. So these appointment reminders can really help with that satisfaction, those satisfaction surveys from the patients that you're taking care of.
You know, I do want to add one thing too. It's not just the flow of information in one direction. It's even having a system where I can press a button and say, someone call me, and I'm not having to take the time to make that phone call. It's literally just popping this open and hitting a button. And so someone knows that I need them at that moment, not 5 hours from now. And the person that responds to me doesn't necessarily need to be the nurse. You want your nurses to be working at the top of their license. Maybe it's supplies that I need. Maybe it's extra oxygen. Maybe it's extra tubing. None of those things would be provided by the clinician anyway. So it's knowing that you can reach out and get the either the information or the tools that you need to help while you're at home.
And are there any other sort of examples that you can you wanted to share, or with the audience, as far as ways that these technologies can kind of help automate or augment that care? Or we cover it pretty much.
No, I think we've got a few more.
Yep.
One thing that we've got some organizations, hospice organizations in particular, trying to create that warm touch point with the caregivers and providers. And they created very creative little 30-45 second introductory video clips. So they'll send that out via a tablet, the computer, laptop, a cell phone, and it introduces, I'm the CEO of this organization. We're here to take care of your needs. You can contact us at any time. And they're really nice welcome messages to those caregivers and family members. And that's gone over really well, right? To set that tone that you are there to provide the best care for them. And lots of different things that we can create. Everything can be customized per organization and what your pain points are, right? Is it just appointment reminders, letting your clients know that the nurse is coming this morning, this afternoon, and keeping those touch points there.
And we don't have and I wanted to have a stop for a moment and just give a reminder to our audience members of any questions or concerns that you come to your mind. Please feel free to use that Q&A function, because one just came to my mind, so that's why I come up. But as far as we mentioned the quality reporting piece of that home health rule. Do you have any examples of how this kind of technology can help with that part?
Yeah, so I think that what you're looking to do with quality reporting, it's a lot of clinical outcomes, right? And so one thing that I think that this proactive engagement or proactive triage does is it starts to catch events that you don't want to happen before they happen. Very often, because the other side of the CareXM business, as a lot of you know, is triage, that reactive triage is that we help you answer calls when they're coming in. We're getting a call when a patient or a caregiver is at a pretty bad point down the road where they need help. And so when you can do things like proactively send out education on medications and have education that's referenceable, those are all going to help your quality outcomes. They're going to help your CAHPS scores, right? We're communicating more. We're being timely about how we're providing care. And I'll just tell you, as we move into this as kind of an interesting generation that's going through hospice and home health, because it's really the first generation that has had any interaction with a smartphone, right? So in Deborah's situation, if I were caring for my mother or father in hospice, I'm not one that really wants to go call somebody. I'd rather text them. I'd rather go try to look up how I handle this pain med online rather than call and bug a nurse. And so having these multiple modalities of communication is going to be something that's really new for this industry, but it's going to become really necessary because you are really now dealing with almost 4 generations in the workforce. You're definitely dealing with 4 generations when it comes to your patients, the families. And so we've got to be able to meet them where they are. And so things like being able to push education, or as Cindy said, able to push custom videos. I'll tell you, we're right in the middle of gift giving season with the holidays coming. We've got a lot of things that we're building around the house. My husband is one that will never read the instructions. He goes to YouTube to watch how to build something. So meeting where you are, does video make sense? Does phone call make sense? Does text, does email, does a survey on the go? Those are all things to consider as part of your program of, am I communicating the best way that I can? And when, as I jump to our next use case here, one aspect that Deborah mentioned was this almost like call button that they could use, where they could get a hold of somebody. And so often with care, I don't need to bug a nurse. I know that nurses are busy, and I know how hard it is to get a hold of one, as Deborah said, sometimes in a timely manner, because they can be in other visits. But if I'm out of briefs, or I need a medication refill, but it's not urgent, it's kind of nice to have a modality where I can asynchronously communicate with my care team to get those needs met.
And oh, okay. Oh, sorry. Go ahead if you were going to jump.
Go ahead. Oh, we can wait for questions.
I just noticed, yeah, we had a few questions coming in here. So I know a lot of your services are augmented towards that triage part. Do you have anything that does sort of augment that advanced care planning elements or documentation, such as like in the telehealth visitations?
Deborah, I can answer that. So
Go ahead.
yeah, so we are able through this platform to help send out documentation. We don't create advanced care plans, but we do have a place where you can do that within the system. We do on the triage side have a ton of resources with best practices in terms of policies and procedures for how to handle incoming requests from patients. But we're not a care planning company where we have that resource. But there are wonderful vendors that do that, that are definitely out there and are worth looking into.
This is more of a triage situation. And
For us in particular, but in terms of technology in general, that's a great way to try to, again, take some of that administrative burden off of your nurses. That would be an excellent, vendor relationship to start exploring.
Have those goals of care conversations.
Yeah, absolutely.
And I think the other one that we had here, I think a good point. So we talk a lot about these caregivers and family members in, the home-based, community-based settings. So what about, this question kind of comes out as far as those that are in, skilled nursing, assisted living, memory care facilities, who would receive that kind of communication when a family member isn't present? And then how would staff kind of interact with that? It's a very good question.
That's a great question. So when you have an in-facility resident, this may change a little bit. It's still super effective. So especially in skilled nursing, some use cases that I can think of is that you could build out, the questions in the survey, the resident interview that you have, you could build out the family interview. And then your team, yes, they do need to respond to requests for help, or if they're not satisfied with care in any certain way. That next example that I was going to give is super relevant to skilled into ALF as well, which are just, straight satisfaction surveys, which you can be a little bit more open about sending than you can in hospice. This platform in particular is so flexible that you can have these go to whoever you like. We have a large home health and hospice organization that uses us not just for patient engagement, but also for employee engagement. So it really depends how you'd like to set up your communication cadence, and what you want to have happen. So you can eliminate as much work for people as possible. I'll give an example. We've got a large organization that's strictly using this for appointment reminders, and their field nurses are coordinating the schedule every evening, right? So they want them to have the flexibility to be able to move people around and fit them into a schedule that works, especially with driving and everything like that. In that example that you heard of the IVR call, it said, you've got an appointment between 8 and noon. Some of our clients say, does this work for you? Press 1 for yes and 2 for no. And in their case, they said, we'd actually rather just have it say, If this doesn't work for you, please call the office, where it does take some effort from the patient to reschedule if that wasn't a great time for them. And so they weren't just willy-nilly changing the schedule. So we'll work with you. And one of the best things I think about our company is folks like Deborah, this clinical knowledge base, and these people that are true clinicians that have worked in hospice, worked in home health, worked in skilled memory care, that can help you to build a program that caters to your specific population, your employees, and your needs.
Great. No, I thank you for fielding those questions. I think they kind of peppered in well to what we're discussing. So just jumping on forward, as far as creating those more patient-centered experiences, how can technology really be tailored to do that? And then what's the impact on that on quality outcomes? I think, Deborah, we had this one for you.
Well, I think it still goes back to the coordination of care and the communication. Let's face it, with their hospice population, you may not really be communicating with the patient at all. You're communicating with the family. And so it's so important to be able to open up the different lines of communication and get as much feedback as you can. Over communicate always, but make sure that you're doing it in a way that is going to be accepted by the family members. That was another area where I just felt like, for me out here doing it as a caregiver and, for my family and as a nurse, it would have been tremendous to be able to have the kind of feedback or to be able to communicate in a way that I needed it at a time when I needed it, facilitating the type of information that I needed. And I have to tell you, because of the lack of that, when I get the phone calls now, trying to see if I was satisfied, I have a hard time even answering them because it was such a poor experience. And I think the technology, having a way to do this, it would have made all the difference in the world for me. And so I can't even stress that enough, because when you're dealing with hospice, are we really worried about getting, improving the patient's overall health status? Not really. What you're worried about is comfort and a nurturing environment for the patient and the family. And you can't do that if you're not communicating with them. And so knowing that maybe I didn't need to speak to the nurse, maybe I needed to speak to a chaplain, being able to reach out proactively and ask for what I wanted, instead of someone, calling me at 8 a.m. in the morning and saying, can so-and-so come out to see you today? Mm-hmm. So the only way that you're going to be able to facilitate that is through the use of technology.
Chelsea, today you have a lot of competing things as that person or that family supporting that seriously ill person. So you might have a lot more than just one question to put in.
For sure. Right. For sure.
To add on to that, and that's a good lead into our next example here is, when you talk about the comfort of the patient, Holly, administrative work is a burden on them too. Mm-hmm. And when you have that start of care and it's a 2-hour appointment, you can imagine how exhausting and overwhelming that feels to the caregiver, to the patient, and how much of that can be done ahead of time, right? This ability to upload consent forms. I don't know if you all see it. I see it when I go to my GP that I get my paperwork sent to me via text message and I'm filling it all out before I get there, and having the ability to kind of separate out those events of this initial visit, which is very emotional, and then to add on to that, this what feels like an endless amount of paperwork. If we could pull that away, can we take anything away from the patient experience that isn't, enhancing what they're going through with us? I think that that's important as well. Mm-hmm. And then Deborah, you're probably the perfect one for this last example here, which is what happens at the end of care.
Yeah. Although I did want to add one more thing to the point that you were making on the previous screen. You can go back to that for me. So one thing I have to say is, when you're sitting there with a family member and a patient and you're going through all of these questions, your mind is in a million places as the caregiver. Okay. And it's impossible for you to listen to what they're telling you, to retain that information, and to be filling something out at the same time. When I think about being able to do it this way, it's so much better, because you're able to really focus on what the clinician is telling you all the information that you think is going to be important for your loved one. Separating those two, and we're finding more and more customers that are doing this, so that then the clinician is really able to focus on the patient and not just filling out paperwork, asking 1,000 questions. So that's an important point that I wanted to add to that. In follow-up with the bereavement period, quite frequently, the bereavement period lasts much longer than the care period does for the patient. And so the follow-up that you get, having this sent out via phone where I could just say yes, no, leave a comment, would have been so much easier for me. When I finished with this whole process, and this is probably very much the same with most family members, you have to take off. And if you're somebody that works, when you're finished with this process, not only are you dealing with everything that has to go on with, making funeral arrangements, doing all of those things that nobody ever wants to have to do, and then somebody calling you and bombarding you and asking you how you're doing. Well, you don't really want to have that conversation. So it's so much nicer to be able to have something where they can communicate with you very quickly. It isn't intrusive on your life. And you still have the ability to say, you know what, actually, I do need a little bit of help with maybe that's something that's going on with the community that can help me. You're also getting back to work. And so you're so busy with trying to get yourself back into a normal routine that it's just something that, and I felt this way, it was very intrusive because, again, they were calling when it was convenient for them, not convenient for me necessarily. 10 a.m. in the morning, I'm sitting at my desk and I'm working. I don't want to have that conversation. So being able to utilize this technology as a bridge between the organization and the caregivers, I think is very helpful and warranted.
I appreciate that. That's really hits home the part I think about that they often spend that bereavement portion, those different stages come in those different availabilities. And when you're able to process, that experience might be at different points of that bereavement journey. So I think that that's a good point to highlight there as well. Okay. We have a good question, I think, as far as, excuse me, I'm losing my voice for a moment. As far as the EMR integration, electronic medical recommendations, and how all that communication is really documented. It's a really good question, I think. Anyone want to field that one?
I can, yes. So our system has bidirectional communication and integration with EMR. So all of this gets then documented in there. Yeah, that is a great question. And your EMR is a really important resource for you to turn to. And what I wanted to talk about next is, how do you decide, of those strategies that we just shared, those are just some examples that you could employ in your own practice, but how do you know where you could potentially automate or employ an engagement, a proactive engagement strategy like this? And my answer is almost always going to be data. We've got a lot of data, we've got a lot of reporting. We don't always know what to do with it. But this is a place where you could kind of lean into the systems that you already have. So your EMR, in our case, we code all of the calls that we take on the triage side. So we know when people are calling in and why. So if you knew, for example, that you had a large amount of your calls coming in about medications, you could then see, why are people calling about medications? If you're getting a lot of refill requests on a Saturday, that would be an indication to me that let's send a proactive outreach, maybe one of those check-in, tuck-in calls, or maybe just a simple question of, are you running low on any medications before we head into the weekend? Now you have quite a myriad of results that come out of that. If they do say, yes, I am low, to the previous a question that we have, your team still has to do the work. They still have to go refill that medication. But I'd rather do that on a Thursday when I'm fully staffed rather than a Saturday night when I'm running with a skeleton crew. Now, the other benefit is your patient has this problem resolved before it becomes emergent of, I've got one pill left and I need it and it's Saturday night. Better patient experience. And then when you think about the lasting repercussions or the down the line repercussions for your practice, that call that would have come in on a Saturday no longer is coming in, right? So when you do things like that, at least in the focus of our business that we know and love, which is triage, both proactive and reactive, that actually starts reducing your call volume, right? So less burden on your staff. So when we can proactively address patient needs, even though somebody needs to address that need, it does end up reducing burden on your staff as well. So if you're looking at, I don't know if any of those strategies that y'all just shared would work for our practice, but the concept makes sense. I'd always encourage you, go into your EMR, see where you are getting communication coming in from patients and families and caregivers, and see, wow, if I were to automate an outreach ahead of time, which ones of those communications could I probably limit? And then you just assume, man, if I'm proactively addressing patient needs, how much less stressful and how much more satisfactory is the experience for the patient?
Yeah. I think that question really leads into our next one, which was going to talk about the challenges that hospices can face when they're sort of adopting or integrating new technologies and how they can overcome those effectively. What I've talked to hospices as they talk about the benefits of these technologies, but sometimes the challenge is like, well, how do I get my existing system, or how do I get all these systems to sort of talk to each other? That's the common buzz phrase I've heard. So as far as things that you guys have heard, what are some of those challenges? And then what are some ways that, hospices can overcome them? And
I'm going to skip ahead and then have you come back to some outcomes that we've seen. But I'll let Deborah, I'll let you kind of walk through these. And Cindy, I know that you've got a lot of experience from the tech side too.
Yeah, so I think some of the challenges are just changing that thought process, things that we've done consistently for years and years. Again, referencing the telehealth, right? Before the pandemic, there was a large resistance against doing virtual or video visits with patients. The doctors, the providers wanted them in the office, but it really proved that it could be very effective in augmenting those outbound nursing visits, getting the patients that are sick, maybe they have COVID or they're at risk of getting COVID. You don't want them in a busy doctor's office. So changing that mindset, and a lot of times it's proof of concept, right? The nurses want you to prove it to them that this is not going to take away that human touch that they have, but it's going to help their day and not complicate it. So technology's got to be easy to use for everybody. That's super important to get that nurse buy-in. And then of course, leadership teams need to really drive those programs out to the entire organization. Because if you get a couple naysayers, they can cause, programs not to be sustainable or successful. So nurse buy-in is really important, and educating them as to why this is going to help them. Staffing shortages, I think we've heard from just about everybody across the country that keeping nurses, retaining nurses, staffing shortages, especially on those weekends, after hours, to have those nurses on call. So as Ellen said, if we can decrease those calls or those have to go out on a Saturday night at midnight or evenings, and again, hospice is different than other healthcare organizations that we work with. But if we can decrease that a little bit and help with that staffing shortage, you'll be able to take more referrals, grow your hospice business without having to exponentially create or hire new nurses.
Yeah, and I think that goes to the last challenge that we see, which is, I think it's really challenging. It's probably pulls in the first two as well, is it's really scary to say we're going to adopt a new technology without having knowledge that it is going to eliminate work, because there's a very real sense where you say, well, if I ask my patients if they need anything, they're going to answer and they're going to need things and we're going to have to go deal with that. Isn't that going to create more work? And it is that trust in the process. And it is really the clinical team that's building this with you to where do we start to prove this to our team, to get the nurse buy-in, to show them that this is actually going to be manageable and give you more time in your day for patient care. And one problem that I see, because our system is so flexible and you can really employ it with a myriad of strategies, is everyone gets really excited and they're like, we can do this and this and this and this. And sometimes it's a little bit better to say, let's start with just one. Let's just do those appointment reminders. Or we have a big client that says, we don't have the nurses to handle all of the incoming responses from our patients. but we did want to start maybe by just doing that start of care paperwork. That doesn't need a nurse to do it, right? We're just having our patients handle it. So really, I think working with your vendor, whoever they are, and their clinical team to know what are some of these strategies that we could start with that can get that nurse buy-in, that can make everybody feel like this is doable, even with the staff shortage, where we can then make the ask to say, let's take the next step. Now we think that we can improve care with this as well. Deborah, did you have anything to add?
I did, because I think what's the most important for the patients and family members is the communication. Whether it's in person or not, isn't the number one priority. It's the fact that it's there. And let's face it, that some of these patients, they're immunocompromised. It's not always the best thing or the best clinical decision to send somebody out there that's already seen 5 patients that day, bringing in all of the germs from every one of those households. So I think you have to use some good clinical decision making with it. And when you talk to nurses in those terms, they seem to listen. And so, it's about utilizing the technology to help you make some of those really good decisions.
And I'll back up to those outcomes, Deborah, because I think we may have skipped over those for you that you were going to talk about.
Sure, this was mine. Are we talking about the patient satisfaction?
Yes. So this is a sample of 1,400 patients that were using this program over 12 months. And you can just see that some surveys to the family members and to the patients that were involved, and how satisfied they were with the care that was provided because of that increased communication that Deborah was talking about. It does improve their feelings about access to care. They felt like they were able to access information about the healthcare condition of their loved one or their medications, in a really high recommendation. So I think the effects on patients and families and caregivers are really evident. And then down the line, you're going to see those effects on your clinicians as well. As I mentioned in the beginning, there's such pressure on retention of our team that any relief that we can provide to our caregiving workforce, our clinicians, is going to make a really big difference as to how well you thrive in this environment going forward.
And sort of what things can be weeded out with that technology. Like I'm coming back to Ellen, the things that you're saying on some of those medication needs and the trends that you saw on a Saturday versus a Thursday. What are things that technology can kind of help you feel, help your staff feel, lighten that load when they're having those high volume days. Yeah, those are very, I think, solid points as far as the outcomes there. Okay, any other things in the challenges realm that you wanted to address, or did you guys have?
No, but
like we solidly covered those
challenges they want to pose. We'd be open to talking about that too if you wanted to.
Well, I can't tell you how many times I've heard a nurse say, when there's all these different tasks, whether it's the charting or the seeing the patients or whatever it is, that, gosh, I wish I could just do my nurse things instead of having to do all of those other things. And so that's where I think the technology is a great workhorse, because you can take over some of those things that maybe aren't necessarily something that has to be done by a clinician. And that's a big relief for the nurses.
Some of those documentation things that you're not always a fan.
I have to do what?
They're important, right? Right. So I think that this really wraps us up home with this last question, as far as just looking at all of these pieces, and given that revolutionary, that regulatory landscape, how do we think that hospices can really proactively anticipate and prepare for any future shifts that are in their pipeline to stay ahead of those CMS requirements? I know a lot of program integrity moves have been made, a lot of quality oversight has been taken the stage. So Ellen, I think I'm going to field this to you, and then Cindy and Deborah just pepper in your thoughts.
Pepper in, yeah. I mean, outside of making yourself a regular reader of the Federal Register, which nobody should do unless they're an insomniac. So I guess it's so fun. So looking ahead, the way that hospice is regulated and paid is it's undergoing a shift towards prioritizing quality outcomes and value rather than just sheer volume. And this is across all of healthcare. It's nothing new to you, I know. But the transformation is really about ensuring that patients and their families receive top-notch care. And there's a really big focus on boosting satisfaction and minimizing hospital readmissions, which hospital readmissions aren't really going to come into play for us quite as much, but satisfaction definitely is going to then take a bigger role when it comes to value-based payment. So right now, the regulations are starting to gear more and more towards delivering care that's not just medically effective, but also tailored to each patient's unique needs. And as I mentioned before, this move away from the old fee-for-service model and towards a value-based approach where it's tied to how well we're meeting patient and caregiver needs when we have a patient and caregiver population that's spawning 4 generations and a very different level of embracing technology, that needs to be where our focus is, right? So patient and family satisfaction are critical benchmarks for evaluating our performance, and we know the emotional and psychological impact of end-of-life care. And so expect all of the regulations to continue to emphasize the need for increased communication, increased compassion and empathy. And that's where, if I were to say any decision that I'm making, let me look at it kind of through that lens. That's what I would do. When you're turning to technology and tools, I would look for ones that are improving your ability to communicate, improving your ability to coordinate care, and really to make data-driven decisions. When I evaluate technology vendors as a hospice provider, that's what I'm going to be looking for. So cost is going to be a concern, right? We are dealing with a net loss. So is there an immediate hard dollar impact? Maybe there's not, but then how is it going to help you to improve quality metrics, satisfaction over time? And while those could be soft dollar costs today, it is an interesting strategy to look through that lens to pick a technology vendor, because it will empower you in the future and set you up for success.
And Cindy, anything to add to that, or Deborah?
I think that was perfect. You wrapped it up great.
Yeah, but I want to say that one of the things that you can utilize this technology for is really providing holistic care. And any good clinician will tell you that that's the way that you need to go. It's about mind, body, spirit, being able to provide all of those things. And I don't think that we can do that effectively without utilizing technology to really be able to reach out to those patients. And there's some things that never change in healthcare. The fact that you want to be nurturing to your patient, which is also very healing to them and their family, and being able to open up the communication and the doors to that via the use of technology, I think is the way that it's going to have to go, in especially when we look at all of the shortages in the staffing.
And how that kind of plays into that regulatory compliance part too, the quality part. Yeah. A lot of pieces here that we unwrapped. And I really appreciate, Deborah, Cindy, Ellen, for each of you for just kind of sharing those thoughts. Deborah, for sharing your very impactful story with the loss of your husband. It takes bravery to speak out and do these webinars. So thank you each. And thank you to our audience for joining us today, for tuning in. We hope you all take care until next time. Thank you so much.
You're welcome. Have a great day.
Happy holidays.